India has once again seen a record daily rise in coronavirus cases with 77,266 fresh cases in the last 24 hours, which brings the total count now to 33,87,500. An additional 1,057 new deaths have brought the overall death count to 61,529. India has the third highest number of virus infections in the world after the United States and Brazil, and India is on the top as far as the daily cases in the world go. Since the last 24 days, that means every day for the last 24 days, we've reported the maximum daily spike in cases. It's also the third day that India has reported over 1,000 deaths. Well, to talk about this situation in the country, how, everyday cases are increasing, but restrictions are also decreasing, and the public is also getting fed up and fatigued by coronavirus and restrictions. We're joined by Dr. Sameer Gupta, cardiologist, a Metro Group of hospitals, also a COVID survivor and a plasma donor. We also have Dr. Sunila Garg, head of Department of Community Medicine, Maulana Azad Medical College, and advisor to the ICMR member task force. Dr. Sunila Garg, I'd like to start with you because the situation facing our country currently is that every day we're seeing a huge number of cases being reported. Yesterday as well, over 75,000, today over 77,000 cases being reported, every single day. But at the same time, we are moving ahead with easing of restrictions. Come September, more restrictions will be eased. So is this the correct way to go? Should we not be worried about, the massive increase in cases and just focus on reducing the deaths and reducing, the hospitalization requirements?
I think you're perfectly right, that we are having poor discipline. First of all, I'll say that we do face poor mask discipline. And as of, if I'll say Delhi, just day before, you see, we got 1,75,000 people who were fined for not using the mask. The second thing is that, you see, the economy has to start. But at the same time, we have to really look at the situation in terms of, you see, whether we are right in exactly going the straight manner in opening of the markets, in opening of the malls, in start the, even in Delhi, we were thinking of starting the metros as well. So that is another thing which we have to keep in mind. The third thing is that, we need to keep our test plateau very high. Something like, I'll give an example of Delhi, that we have to go, today even the Chief Minister said that we must be testing about 40,000 people a day, whereas we have been testing about 17,000, and most of the tests have to be RT-PCR tests, not the antigen-based tests which give you a false sense of security. Another thing is that, we must keep in mind, like in Europe, we have got, they said that the second wave is coming. Of course, we are not sure in Delhi, but we need to keep all these things in mind. And another important thing, which is very, very important, is that as a public health expert, I'll say that we must keep a watch or a careful watch or a monitoring on our Delhi situation from where the cases are coming state-wise, rural areas, urban areas. And also, we need to see what is our doubling rate and what is R naught. A few days back, we had R naught less than 1 in Delhi.
Yes.
And yes, we are talking of R naught, which has gone more than 1 now. So, and still we have to keep in mind, based on our Delhi results, that we have got 2/3 of our population which is still unexposed. We only have 29% from the second round of survey in Delhi which showed that only 29% of people have antibodies, but 70% do not have antibodies. So we are much more susceptible, we are becoming lax, we are complacent, and our monitoring needs to be very stringent.
Right, absolutely. And Dr. Gupta, if I could come to you here, you, of course, as we mentioned, are a COVID survivor, but a lot of experts also point out when we talk about, the numbers of cases increasing and the deaths, that India, if we compare to other top, in the top 3 countries, we have 43.82 deaths per million, which is much lesser than what the US and Brazil have. US has 542 deaths per million, and Brazil 553 deaths per million, and they point to the fact that India has kept the death rate down.
Yeah, we've been fairly fortunate that the death rate in India is not as high as it has been in some of the Western world. And the reason for that is, whether it's the BCG vaccine helping, or whether it is the plethora of infectious diseases that a country has, which has led to an increase in immunity, or they're probably helping in some way, shape, or form. Also, it is important to remember that when India is, as we peak, as our numbers continue to increase, we had a 2 to 3 month headway as compared to some of the other countries. We saw what is happening in Italy. We saw what was happening in America back in March and April. So we learned from them. We learned what is working, what is not working. We learned that masks are important. We learned a lot of these things, and we started implementing them very early. And that certainly helped as the case numbers in India started increasing. So these are some of the things that have been helpful. And it's also important to remember, we just talk about death, right? We just talk about death, or this person has X number of people are dying. But we've also learned that with COVID, we have a lot of morbidity associated with it. What I mean by morbidity is you don't die, but you get really sick, the first thing. And even when you recover, you tend to have this post-fatigue syndrome that we're learning about. So that should also not be completely put on the side. That's a reality.
In fact, I wanted you to talk a bit about that as a COVID survivor yourself. And, now it seems a lot of young people, a lot of people moving around, they're fatigued by all these restrictions. They're going meeting, they're socializing, restaurants have opened, people are going out, they're going to malls. And there's this sense that, all right, COVID will happen and people have recovered and everybody's fine. So if you could tell us, a warning to those people not to take it so lightly.
So this is something that we've seen, right? I mean, we've seen across the world that, when America tried to open, when people start getting fatigued with everything, there's a second wave which comes. We saw that with the Spanish flu, and we're seeing that now also, right? That as people start getting fatigued, as they start getting lethargic, oh, forget it, man, this is fine. Let's go party on Memorial Day weekend. And boom, the case numbers just went exponentially. So as we start relaxing, as we start doing this, it's a Hamletian dilemma, right? Whether to open or whether to close. I think that's a tough decision. But what we should be realistic about is that if we open, and as we are opening, the case numbers will increase. We know that, right? So if this 75,000 tomorrow becomes 1 lakh, we should not be surprised because we are expecting this. And just because, caution fatigue is something which is real. I'm seeing it everywhere. I'm seeing pictures of people on social media posting small get-togethers, etc. And that is just, a recipe for disaster because the case numbers will increase and you can get sick. And the doctor before me said,
All right, Dr. Sunila Garg again. So the tricky part of all of this for the administration, for state government, for central government is to balance, as you said, the needs of the economy as well as, the health of the people. And at the same time, another, aspect of all of this is that from the cities now it's going into smaller towns, something you just pointed out, rural India. And that's also a big cause of concern to, if the health services there are able to provide the healthcare that's required.
Yeah, definitely. That is one of the important part. During the lockdown, when we prepared, our urban areas, one of the important things which we must have kept in mind is that whether overall the country is prepared to face up the situation. Because earlier we presumed that this disease is mostly confined to the urban part of the area, but because of reverse migration, what we realized during lockdown, people started going back, but our systems were not as much prepared. Now gradually we are gearing up with the systems and all that, but that is another important thing, that we need to treat country as a whole, and we need to reduce the differentials between the rural, urban and different states as well by increasing the system's response. So that is another important thing which I must say. The second important thing is that besides addressing the mortality, we need to address the morbidity, as has been just pointed out, because disability adjusted life years are also a very important aspect of public health. That means people will not be able to do their jobs anyway. If they are disabled, they are suffering from inflammatory disease. They are not able to cope up with the routine activities. So that is important. But from the public health perspective, I will say the monitoring of the situation in rural areas, urban areas, in different districts, or inter-differential variables, state-wise variables is very, very important. We must look at every state very, very carefully, and we must do the daily monitoring. So that's important.
All right. Well, thank you so much, Dr. Sunila Garg and Dr. Samir Gupta, for joining us on the show today.